Hong Kong is administering COVID booster shots in an attempt to protect the public against the mutating COVID virus. But opinions are divided as to whether that's necessary.
Oh, definitely have to take. Yeah, we have to travel,
Honestly, not yet, because of the side effects.
Are booster shots necessary? Government Health Advisor David Hui says the answer is yes.
Because the Delta variant actually has reduced the vaccine effectiveness. And also with time, the neutralizing antibody level actually will drop with time.
He says recent outbreaks in Israel and Singapore prove the effectiveness of booster campaigns.
Israel actually achieved high vaccination rate with 2 doses very early. However, with time, the antibody level dropped. So Israel actually encountered 4 big waves. The 4th wave was actually very severe. At one stage, they had more than 10,000 cases per day. But since Israel has introduced the booster dose, and they are now down to about 1,000 cases per day.
Singapore is another example. The Lion City has turned the corner on its latest wave of infections with a mass rollout of booster inoculations.
呢個就係 Israel 第4波。
Israeli data found some 16% of BioNTech recipients' antibodies dropped to a low level about 6 months after the second shot. And the mainland study shows antibodies of most participants fully jabbed with Sinovac waned to low or even undetectable levels 6 months afterwards. That means they cannot fend off COVID-19. A booster dose can prolong the defense against the virus, whether it's the same vaccine brand or a mix and match. Research by the Chinese university on some Sinovac takers found a mix and match with BioNTech booster developed higher levels of antibodies against COVID. But both types of boosters are relatively effective in preventing COVID hospitalization and fatalities. Professor Hui says common side effects of the booster shot also include injection site pain, fatigue, and sore muscles. But he says they will not be any worse than those of the second dose. Hui also says we may need more than a 3rd dose to maintain our protection.
Theoretically, it will protect us for no less than 6 months. So maybe 1 to 2 years' time, you need to have another dose.
So get ready to roll up your sleeve for future inoculations if and when the need arises. 東有嘢 TVB News。